Massachusetts.
Thank you, Mr. President. I rise today to urge my colleagues to vote against the nomination of Tom Price to be the Secretary of the Department of Health and Human Services. You know, the decisions made at HHS touch the lives of every family in America. The Secretary who runs this agency makes decisions about everything from the safety of the food we eat, to the drugs we take, to the health insurance we buy, and the quality of the nursing homes that we live in. This is an extremely important job, and we should not hand over the keys to this agency unless we are certain that the person will put the American people first every minute of every day. President Trump has nominated Congressman Tom Price to serve in this job. Unlike many of the president's other nominees who are stunningly inexperienced in areas where they will be setting policy, Congressman Price has a lot of experience in healthcare policy. Yes, he has experience, but it is the kind of experience that should horrify you if you care about Medicare, if you care about Medicaid, or if you care about your own insurance coverage. Congressman Price's record is perfectly clear. He wants to destroy fundamental protections that millions of Americans depend on for their health and economic security. And frankly, he isn't very subtle about it. He has described the ACA's ban on discriminating against individuals with pre-existing conditions as, quote, a terrible idea. He has voted 10 times to defund Planned Parenthood, voted 10 times against a group that provides life-saving cancer and sexually transmitted infection screenings to millions of patients a year. He has tried to privatize Medicare and raise the age of eligibility. Privatize Medicare, think about that one. And he has been one of the chief boosters in Congress for gutting the Medicaid program. The Medicaid program, which provides health care for millions of kids, for people with disabilities, for families with parents in nursing homes, cut money to keep people in nursing homes. Nonpartisan analyses of these plans are not pretty. Millions of people in this country, young and old, children and grandparents, poor and middle-class workers, would be denied access to life-saving care. Congressman Price touts his own magic numbers that say different. But make no mistake, this is the record of someone who wants to use his position at HHS to advance a radical, reckless agenda that puts right-wing, anti-government ideology ahead of the health and safety of the American people. During his hearing before the Health Committee, I asked Congressman Price some really pretty simple questions. I asked him about more than $1 trillion in cuts that he has proposed to Medicare and Medicaid. I asked him if he would keep or undermine President Trump's campaign claim that he would protect these programs. I asked him to guarantee that not $1 in cuts to Medicare would take place on his watch. I asked him to guarantee that not $1 in cuts for Medicaid to help people living in nursing homes would happen on his watch. I asked him to guarantee that not $1 in cuts for people with disabilities would happen on his watch. I asked him 3 separate times to make this commitment, and 3 separate times he refused to do so. I want you to think about that. Cut Medicare for millions of seniors, cut help for people with disabilities, cut Medicaid for people living in nursing homes. That is the person that Donald Trump wants to put in charge of those programs. You know, we have a lot of work we need to do on health care. We need to reduce the cost of insurance. We need to make sure that insurance is available to small business owners and to gig workers and to part-time workers. We need to make sure that insurance continues to cover health care for women and people with pre-existing conditions who otherwise are not going to be able to get insurance. What we don't need is to put someone in charge who is hell-bent on destroying health care in America. For me, this is easy. When someone says he wants to cut Medicare, I'm done with him. When someone says, let's take away the money that people rely on to pay for nursing homes, this guy is finished. When someone says that protecting people with pre-existing conditions is a bad idea, they don't get the job. This should be easy for everyone in Congress. This is a moment for Senate Republicans to step up and say no. But there is another reason to reject Congressman Price's nomination. Reason that has nothing to do with his terrible ideas. A reason that would disqualify him even if we agreed on every single issue. The reason is basic ethics. During his time in Congress, Mr. Price has made money by trading hundreds of thousands of dollars worth of stock in healthcare-related companies at exactly the same time that he pushed legislation that could affect the value of these stocks. His formula has been pretty simple. First, he buys the stock, then he pushes bills to help the company, which helps the stock price go up. For example, Congressman Price bought stock in a company that makes hip and knee replacements, and then he introduced a bill to suspend a federal rule affecting Medicare reimbursements for hip and knee replacements. Congressman Price bought stock in a bunch of pharmaceutical companies. Then he co-sponsored a bill to suspend a federal rule that would hold down drug prices for these companies, for the drugs that these companies manufacture. Congressman Price bought stock in an Australian biotech company with an experimental drug to treat multiple sclerosis. And then he voted for a bill that would make it easier for the FDA to approve these drugs. So what does Congressman Price have to say for himself? How does he explain this connection between buying stock, then supporting changes in the law that would boost the value of the stock that he just bought? Well, he's got his excuses lined up, and I have to say, they are doozies. He says he didn't know about the trades. His broker made them without asking him first. Oh, wait, he did know about the trades. He just happened to know about an obscure Australian biotech firm, and he just happened to decide to invest as much as $100,000 in it because it was a good investment. And then he hit his last excuse. Hey, it's all okay because he paid the same price as anyone else who bought the stock. Wow, that is really a heaping, steaming pile of excuses. And the excuses stink. These are Congressman Price's stock trades, not anyone else's. He made those decisions to buy those stocks, and then he repeatedly pressed for rules that would increase the value of those stocks. In fact, with one of the deals, it isn't just a question of stinkiness, it's a question about whether or not he broke the law. By his own account, Congressman Price found out about an Australian biotech company called Innate Immunotherapeutics from a fellow House member who, it just so happens, sits on the company's board and holds the largest stake in the company. So when he decided to buy his latest batch of stock, Congressman Price got access to a private sweetheart deal, meaning he got a discount on the price of the shares that the general public couldn't get. This sequence of events might break the law. That's not good at all. And getting special access to a sweetheart deal doesn't help your claim that you're just an ordinary guy with a boring stock portfolio. So when Congressman Price appeared before the Finance and Health Committees, he said that he had not paid a lower price than had been available to other investors. Whoa, that is just not true. The company itself pointed it out. In fact, Congressman Price got a special discount that went to only 20 people in the country. 20 special friends, including the congressman, who could help write the laws that would make the company even more valuable. An outside watchdog has called for an SEC investigation into whether Congressman Price has committed insider trading. Price lied to Congress about his trades, and that should be the end of it. No more nomination for Secretary of HHS. The congressman should have the decency to withdraw his nomination. It should have happened weeks ago. And if he didn't go voluntarily, the president and his friends in Congress should have quietly but forcefully pushed him out. But that's not what happened either. Instead, Republicans barreled straight ahead, and they changed the rules to do it. Since Congressman Price lied to the committee, Democrats wanted him back for another hearing to ask him about that. Republicans refused, and Democrats boycotted the Finance Committee to try to force Price to explain why he lied. So the Republican response was just suspend the Senate rules so they could run around the Democrats and move forward Price's nomination anyway. Do we not care about basic ethics anymore? Is that just gone? A congressman should not be buying stocks, then pushing laws to help the company. And that congressman sure shouldn't be lying to the United States Senate about it. Because Congressman Price has no shame, it will take 3 Senate Republicans to reject his nomination. Where are the 3 Republicans who will say no to a man who bought stock and then tried to get the rules changed in Washington so the companies would be more profitable? Where are 3 Republicans who will say no to a man who got a special stock deal that went to only 20 people in the whole country? Where are 3 Republicans who will say no to a man who lied to a Senate committee? This has nothing to do with politics. It is about basic ethics. It is about potentially illegal behavior. Where are 3 Republicans who will say no to this man? When Donald Trump selected Congressman Price for this job, he said Price was, quote, part of a dream team that will transform our healthcare system for the benefit of all Americans. Over the past few weeks, I've been trying to understand exactly what that dream looks like. For families all over this country, the dream is pretty simple. They want to know that when they get sick, they can go to the doctor and not be hit with a surprise bill that they can't pay. When they buy insurance, they want to be sure that it covers birth control and cancer screenings and pre-existing conditions. They want to be able to fight cancer and not lose their house or declare bankruptcy because their insurance company imposes a lifetime limit on benefits. President Trump does not share this dream for health care in America, and neither does Congressman Price. From his first day in office, President Trump has acted to undermine access to health care. And now he has nominated an HHS secretary who will help him sabotage our nation's health care system from inside the Department of Health and Human Services. Yeah, we have our differences over health care. And yes, there are fixes we need to make. But where are 3 Republicans who will say no to a man who wants to cut Medicare? Where are 3 Republicans who will say no to a man who wants to cut nursing home care? Where are 3 Republicans who will say no to a man who wants to cut insurance coverage? Democrats can't do this alone. 3 Republicans need to put aside partisanship and stand up for the American people. We need you. The American people need you. With